Depression is a constant feeling of sadness and a loss of interest, which stops you doing your normal activities. Different types of depression exist, with symptoms ranging from relatively minor to severe. Generally, depression does not result from a single event, but from a mix of events and factors. The four main types of depression are situational, biological, psychological, and existential, each of which has its own primary cause. These classifications often overlap, and they're meant to add insight to a diagnosis and treatment. St. John's wort is now being recognized for its effect on depression due to its powerful anti-inflammatory effect, as well as its effect on neurotransmitter production. It's thought that a lot of the symptoms of depression are actually due to inflammation that interferes with the proper functioning of the brain. Posinol is an extract from the herb Apicum ventum, and it has antidepressant effects. It's recognized for its ability to lower blood pressure, and it has therapeutic effect for its potential for hypertension, hypercholesterolemia, depression, and anxiety. It contains no less than 4% of the flavonoid glycoside isoquercetin, and it also contains hyperoside. Hyperoside, it's known to be most efficacious in mental relaxation and in reducing blood pressure. It works with the brain's naturally occurring chemicals, which are neurotransmitters, including norepinephrine and dopamine. The way that Posinol differs from St. John's wort is that it doesn't contain hyperforin, which is an active compound that interferes with the metabolism of certain pharmaceuticals. This makes Posinol a safer option when being taken with prescription medicine. Magnesium is one of the most essential minerals in the human body, connected with brain biochemistry and the fluidity of neuronal membranes. A variety of neuromuscular and psychiatric symptoms, including different types of depression, were observed in magnesium-deficient people. Mechanisms of antidepressant action of magnesium are not fully understood. Most probably, magnesium influences several systems associated with the development of depression. The first information on the beneficial effect of magnesium sulfate given hypodermically to patients with agitated depression was published almost 100 years ago. Numerous preclinical and clinical studies confirmed the initial observations, as well as demonstrated the beneficial safety profile of magnesium supplementation. Thus, magnesium preparations seem to be a valuable addition to pharmacological management of depression. The best form of magnesium is to use magnesium bisglycinate. In order to determine your daily dose, slowly increase until stomach discomfort or diarrhea occur. Then gradually reduce your dose until you find the maximum tolerable daily dose that doesn't cause any stomach upset or diarrhea. As magnesium is required by hundreds of enzyme systems in your body, profound benefits may be noticed after a couple of months of supplementation. Zinc is also required by many enzyme systems in the body, so also supplementing with 50 milligrams of zinc picolinate per day may have a synergistic effect, and also zinc supplementation has been shown to have antidepressant effects in humans. Supplementing with vitamin C may help to improve both mood and cognitive function. Studies have also indicated that vitamin C may reduce symptoms of anxiety as well as depression. You should take vitamin C as liposomal vitamin C or as non-acidic vitamin C. Don't use cheap acidic ascorbic acid. Bioflavonoids also increase the benefits of vitamin C when taken together. Glutathione is a versatile antioxidant that helps with many vital processes within the body, including its ability to reduce oxidative stress. Glutathione supplements don't directly raise the dopamine levels in the brain. Instead, they improve the efficiency of dopamine in the brain, and they also increase the sensitivity to dopamine and to serotonin. There was a study published in 2012 in the Journal of Psychiatric Research. The authors took two groups of people. One group was healthy, the other group was diagnosed with depression. Using skin biopsies, they found that folks diagnosed with depression had higher levels of free radical damage and accumulated oxidative stress. Oxidative stress is a key variable in the development and the progression of depression. It was noted that one remedy for reducing the oxidative stress is to increase glutathione levels. Some ways to ensure that you have sufficient glutathione levels. Remove any mercury amalgam tooth fillings. Ensure you have enough selenium. Selenium is required for your body to synthesize glutathione. One way to ensure that you get this is to eat 3 Brazil nuts per day. You can also take reduced glutathione at 1000 milligrams per day. Take 500 milligrams of N-acetylcysteine 3 times per day, and take the herb milk thistle. Research has shown that vitamin D might also play an important role in regulating mood and warding off depression. In one study, scientists found that people with depression who received vitamin D supplements noticed an improvement in their symptoms. You can get a 25-hydroxy vitamin D blood test, and you can supplement with vitamin D3 accordingly. Vitamin D works synergistically with vitamin K2. Vitamin K2 normalized blood glucose, reduced anxiety and depression in a rat study. The maximum amount of vitamin K2 that your body can absorb in a day is 300 micrograms, therefore taking any more is not necessary. People who are depressed have elevated levels of stress hormones such as cortisol, which can lead to problems with glucose or blood sugar metabolism, increased insulin resistance and the accumulation of belly fat, all diabetes risk factors. When the amount of sugar in the blood is insufficient to fuel the body's activities, hypoglycemia occurs. While this condition has been universally accepted as a cause of depression, even skeptics will agree that hypoglycemia can cause weakness, mental dullness, confusion, and fatigue. Due to the fact that too high or too low blood sugar can exacerbate your depression, proper blood sugar regulation is important when trying to treat depression naturally. Some of the best ways to normalize blood sugar are a ketogenic diet, a low carbohydrate diet, which is high in fiber, increasing your insulin sensitivity with supplements like chromium and vanadium, and ensuring you get sufficient sleep. You can see my other video on blood sugar for more details. Cortisol. This stress hormone raises in depressed individuals. If you're a male, there's a relationship between decreased testosterone and increased cortisol stress hormone. So male hormone replacement, also known as testosterone replacement therapy, can be effective at reducing depression in people over 30 years of age. You can see my other video on testosterone supplements for more information. The supplement phosphatidylserine, taken at 600 to 800 milligrams per day, or drinking tulsi tea, also known as holy basil, can help control cortisol. Also, proper sleep helps to control cortisol, so you can see my other video on herbs and supplements for sleep for more information on this. Homocysteine. Your MTHFR gene can determine how you cope with homocysteine. Numerous mental health conditions have been linked to over-methylation and under-methylation as a result of your MTHFR gene or your diet. Under-methylation, histodylemia. Too little methyl, which is a carbon group with 3 hydrogen atoms. Essentially, they have low levels of SAMe, which donates methyl. This can lead to perfectionism, high accomplishment, and high achievement. 15 to 20% of these people experience problems as a result of undermethylation, and this can lead to low levels of serotonin, making them more susceptible to depression. The undermethylation can lead to a number of deficiencies in nutrients throughout the body. Some researchers believe that if a person is a poor methylator, they're likely to have high levels of histamine, reduced zinc, and a high basophil count. So they have high histamine, low zinc, low copper, high basophil count, high homocysteine, and they can have high heavy metals. Keep in mind that if you're suffering from undermethylation, you may not experience every symptom on the list. There are different genetic polymorphisms of the MTHFR gene, as well as other factors that can dictate what you'll experience. Some symptoms, though, that you could have would be addictions, competitiveness, concentrative endurance, delusions, headaches, high achievement, high libido, obsessive compulsions, oppositional defiance disorder, inner tension, lower pain tolerance, perfectionism, phobias, ritualistic behaviors, seasonal allergies, self-motivation, social isolation, and you could be very strong-willed. If you're an undermethylator, there's some supplements that can help target this and fix the problems, like choline, calcium, magnesium, DL-methionine, omega-3 fatty acids, SAMe, MSM, trimethylglycine, vitamin B12, and vitamin C. If you watch my other video on bipolar, you can see a breakdown of undermethylators and overmethylators to try and determine which one you most likely are. Niacinamide. Some say that it reduces feelings of sadness and hopelessness, and others say that it made their depression completely go away. Niacin, as high-dose niacinamide, has been used for treatment of mood disorders since the 1960s. You can see my video on schizophrenia for more information on this. L-theanine, which is extracted from green tea. A study suggests that chronic 8-week supplementation of L-theanine administered is safe, and it has multiple benefits for people with depressive symptoms, anxiety, sleep disturbance, and cognitive impairments. Studies consistently support the conclusion that a consumption of 200 milligrams of L-theanine results in increased alpha brainwave activity within 30 to 40 minutes. When your brain's alpha waves are dominating, you're likely in a state of wakeful relaxation. Relaxation techniques like mindfulness and meditation may also help to increase your alpha brainwaves. This in turn can make you feel calmer, less anxious, and according to some, may even boost your creativity levels. Again, doses of theanine can be 100 milligrams up to 1000 milligrams per day. L-tryptophan is an amino acid found in food. Results from a study indicated that increasing dietary intake of tryptophan may affect depression and mood scores of healthy participants, resulting in less depressive symptoms and better mood states when more tryptophan was present in their diet. A typical dose could be 500 milligrams to 1 gram before bed. However, some people take much higher than this. It suggests that tryptophan ingested in food might need a period of more than a day, though, to be converted into melatonin. This suggestion is supported by a study of the circadian rhythm of serum tryptophan and blood serotonin in humans. However, melatonin supplements, on the other hand, can increase your melatonin levels within an hour or so. Both of these can help with depression by helping improve your circadian rhythm, which is your wake-sleep cycle. A 2014 animal study found that CBD's effects on the receptors in the brain produced both antidepressant and anti-anxiety effects. And a more recent 2018 review of existing studies concluded that CBD has anti-stress effects, which may reduce depression related to stress. You can see my other video on CBD in the brain for more information about dosing and effects. Mitochondria are membrane-bound cell organelles that generate most of the chemical energy needed to power the cell's biochemical reactions. CoQ10 increases the ability of complexes 1 and 2 to transfer electrons down the mitochondrial electron transport chain, and therefore can reduce mitochondrial superoxide production. CoQ10 acts as an antioxidant which protects cells from damage and plays an important part in their metabolism. Results of a study show that lower CoQ10 plays a role in the pathophysiology of depression. It's suggested that depressed patients may benefit from CoQ10 supplementation. In various studies, doses of CoQ10 range from 300 to 500 milligrams per day. PQQ, taken at 40 milligrams per day, may also enhance CoQ10's performance. You can see my other video on mitochondria boosting supplements for chronic fatigue for more information about this. 5-HTP. Taking 5-HTP by mouth seems to improve symptoms of depression in some people. Some clinical research shows that 5-HTP might work as well as prescription antidepressant drugs for improving depression symptoms. In most studies, 150 milligrams to 800 milligrams per day of 5-HTP was taken. The plant passion flower, Passiflora incarnata, is a perennial plant with documented therapeutic properties. The literature suggests that passion flower itself, as well as its preparations, help to reduce stress and can therefore be helpful in the treatment of insomnia, anxiety, and depression. Passion flower works similar to Valium, but without the side effects such as dulling of the personality. You can see my other video called "This One Herb Can Replace Prozac and Valium" for more information about consuming lavender oil for depression and other mental health conditions. A deficiency of vitamin B12 can result in hematological changes, neurological and psychiatric problems, which can manifest as irritability, changes in personality, depression, and memory loss. It's also known to worsen depression by excitotoxic reactions caused by the accumulation of homocysteine. It should be taken in the form of methylcobalamin in an oral sublingual form under the tongue for best absorption. Note, a B12 blood test may give false results, as food is now fortified with folic acid, which can throw off a B12 blood test reading. However, as B12 is a water-soluble vitamin, it's considered safe and there's little concern for taking too much. Instead of the strong prescription form lithium carbonate, which is toxic, lithium orotate is a low-dose essential trace mineral which can have many normalizing effects on the brain's neurotransmitters. Lithium orotate intervention demonstrated benefit in treating alcoholism, as well as associated with improvements in migraines and depression. Other studies show that lithium orotate may reduce the frequency and the severity of migraine attacks and improve depression associated with bipolar disorder. Typical doses can be anywhere from 5 to 50 milligrams per day, depending on the severity of your symptoms and how you respond to the compound. Omega-3s can easily travel through the brain cell membrane and interact with mood-related molecules inside the brain. They also have anti-inflammatory actions that may help relieve depression. Typical doses range from 3 to 9 grams per day of an EPA, DHA, molecularly distilled fish oil. To conclude, the most sensible way to go about treating depression is to start taking the essential nutrients like the B vitamins, omega-3s, vitamin K, vitamin D, and a multivitamin, etc. Then take the supplemental neurotransmitter precursors such as L-tryptophan, L-theanine, D-L-methionine, and trimethylglycine. Herbal medicine, which is stronger, should be used at the start of treatment to speed up the symptom relief for the patient, like St. John's wort, passion flower, valerian, etc. Once the depression is under control, the herbs should then slowly be reduced after a period of 3 months, and the supplements and the neurotransmitter precursors should be continued. All throughout this treatment, exercise, diet, and sleep should be improved, because in most cases, imbalances in these are what greatly contributed to the depression developing in the first place. Always consult a medical professional when supplementing or making life changes.